okay, recording? Yes, perfect. Hi, right, okay, so this is intro to low leg and ankle, so sports massage. So, can you see this?
Yeah.
Yeah. So what we're going to do today is we're going to have a quick anatomy recap and a quick self-assessment with those sheets that you've already picked up. And then we're going to build on our current knowledge that we have today to make our techniques more sports specific. So building on our Swedish massage training that we've got already, we're going to start getting more sports massage specific. And we're going to do this by learning how to apply deep pressure during our treatments and learn how to use our other tools of application. So I'll talk about that later. With regard to advanced sports massage therapy, like the PNS, the STRs, that will come at a later date in their own right, as their own subject. So first of all, if we just do a quick verbal anatomy recap. So as sports massage therapists, it's key that we always think about what structures are underneath our hands. So if we're going to be massaging, we need to think about what our hands are on, what muscles, what joints we're working about. So we've moved on now from performing a set routine, as we have done with Swedish massage, and following a set routine with standard strokes, and we're going to start working much more specifically. And that's when we're constantly drawing on our anatomy. It becomes much more important. So what I mean by that is that we need to know what muscles we're on, where they originate, where they insert, what direction the muscle fibres are running in, so that we can work with the fibres or we can work across the fibres. We need to know what joints we're working on and what movements are available in those joints so that we can detect any abnormalities or dysfunction. So so we're going to be constantly going back to anatomy and physiology for the rest of your training now. So let's just have a quick verbal anatomy recap as a group. So with the skeletal system, so we're doing lower leg today. So we've got lower leg, so just pop your sheets to one side for a moment. We'll do that in a second. So think about the skeletal system, lower leg. Who can tell me what bones we have in our lower leg? So
Tibia.
Perfect. So the large flat shin bone that's more palpable is our tibia, and then the smaller, thinner bone on the lateral aspect is the fibula. I always remember it, but I used to always forget which was what, so I used to call it a little fibber, because it's on the outside. So at the proximal end of our large shin bone, the tibia, that flares into the medial and lateral condyles, so that forms the knee joint, the tibiofemoral joint. And then at the distal ends of the tibia and then the distal end of the fibula, we've got these bones here at the ankles. Can anyone remember what they're called? Yeah, perfect. Malleolus. So the malleoli, so medial and lateral malleolus. So this is the ankle joint. So this is maybe what we'll consider more when we're working lower leg today. So these malleoli, they are attaching onto the foot with a bone that's here on the ankle. Does anyone know what it's called? If I tell you that the joint that is formed there is called the talocrural joint.
Yeah, it's the talus.
It is, yeah, it's the talus. So we've got the heel joint, which is the calcaneum, and then you've got the talus bone that sits on top of it. And these malleoli are coming on either side of that talus. And so that gives us this joint here. So if I do this action, do we know what kind of joint that is? I mean, obviously, is it a
Really
ball?
moving synovial?
Perfect, synovial, so it's a moving joint, and we've got different kinds of joints, haven't we? So we've got ball and socket, hinge joint. Perfect. So we've got a synovial hinge joint, and it's doing what action at the foot? What's this called?
Dorsiflexion and plantarflexion.
Yeah, perfect. Plantarflexion and dorsiflexion. Great.
Is dorsi towards you?
Dorsi is up,
Yeah,
plantar. I always think plant,
Yeah,
floor,
plant
plant
fly,
seeds.
dorsi,
Yeah,
yeah.
so it's down and up. There is another movement that occurs at the ankle. Does anyone know? Yeah. Do you know what that's called?
Inversion and eversion.
Inversion and eversion. Now, that doesn't actually occur at this talocrural joint, so it's not at this articulation between the talus and the bones of the lower leg. It happens at the subtalar joint, so we talked about the calcaneum, which is the heel bone, and then we've got the talus on top, and there's the underneath section of that talus articulates with the calcaneum, and that's where inversion and eversion comes from. So just remember that it's a different joint, essentially, but yeah, you've got dorsiflexion, plantarflexion, inversion, eversion. Tibia, fibula, condyles and the malleoli. Great, good stuff. So let's do our soft tissues. So pick up the sheets that are beside you. We're just going to do a little self-assessment. This is really mainly just for you guys to spend a few moments to think about what your muscular anatomy level is at the moment. Just fill out what you can. There should be a pen.
So, can I ask a question?
Yes, of course.
So that you're saying that's the same muscle there?
Yes.
So that's all gastrocnemius. Is that soleus? No.
Actually, that isn't, but...
So that one, is it 11 soleus? No.
So should we do it together?
Maybe.
Or should we prepare a moment?
Well, I'm just doing the same muscle again and again.
Some of the same letters.
So soleus further down, soleus number 5. No.
Yeah.
It is.
Yeah, it is really hard because what you've got to remember is muscles are layered upon other muscles. And so when it comes to thinking anatomy, it is hard because you've always got to think what's superficial, what's deep. Sometimes you can't access the muscle that you want to access, or it will become accessible at one certain point. So this is why it's really key to constantly remember what structures are underneath your hands.
The one down the front here is really annoying me to tell what it is.
Yeah.
Is it the perineum? No.
No. You're close for
Perineal.
perineals,
Yeah.
but that's not the anterior one. So let's do it together. So number 1 is tibialis.
Okay. Number 1, tibialis anterior.
Tibialis anterior. So that's your anterior muscle. Very superficial, easy to palpate. As soon as someone dorsiflex, you can feel it pop up in your hand. So number 4.
Gastrocnemius.
Yes, gastrocnemius. So with the gastrocs, do we know anything about the origin and insertion of the gastrocs?
Do?
As in, don't worry about...
Patella?
Yeah. No.
Wouldn't it be the calcaneus as the origin, and then insertion would be... Would it be the base of the femur?
Yeah, so that's what I'm trying to get at. The gastrocs is a biarticular muscle,
Yeah.
so it crosses the ankle joint via the Achilles, and it crosses the knee joint and attaches onto the femoral condyles. That's why it's so prone to injury, because it's crossing the 2 joints, so it's dealing with 2 forces, 2 planes of movement. So it is a commonly injured site. There are some other muscles in the body, but that's the only one in the lower leg that cover 2 joints. They're called biarticular.
Okay.
So yeah, well done. That was gastrocs. And then underneath the gastrocs at number 5 is...
Soleus.
Yes, soleus. So if ever you're trying to work soleus, or if you're ever dealing with calf tension, it's not necessarily always gastrocs. You've got to think that there is another muscle underneath the gastrocs that sometimes needs working out. And then the only other ones that were to be filled in were 11 and 12. And they are these muscles that are on the lateral aspect. And you've been saying it, perineals. Yeah, there's 3 perineals. There's actually only 2 on that diagram, but yeah. So there's a lot of anatomy to think about in the lower leg. That was just a bit of a recap. Lovely, well done. Put your sheets to one side. Okay, so now that we know what structures are underneath our hands when we are working, as we know, sports massage tends to work that bit deeper. So we achieve deeper pressure by using intention. And what I mean by that is that we use our intention to focus on depth. So as opposed to Swedish massage, we've been doing superficial movements and we've been just brushing across the surface of the skin. We're now going to start thinking about going down through the structures. So the way we do that is that we slow down, we work slower, and we work with intention to imply pressure. So we think about going down, deep, and then we move across. To do this, we use our body weight, because obviously we're going to be applying much more pressure, and we're going to be using different tools, which I'll talk about in a moment. So we often use our body weight so we can lean into our treatments. But I put watch your posture there, because everything is going to come back to posture, 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 because we're using deeper pressure now. So in order to achieve the right pressure, we're going to need to use our posture, but in order to protect yourself and protect your joints and have longevity of career, you have to think about your posture. So all practicals from now on will be coming back to anatomy and posture, I'm afraid. So we also achieve deeper pressure by using intention to work on smaller areas. So we're not brushing over the full body anymore. We are focusing on problem areas. So this might be an area that you felt underneath your hands to be tight or tonic, or you suspect there's scar tissue there, or it may be an area that the patient has presented themselves with and said, it's hurting here. And so this is again where your anatomy comes into. So you're thinking, okay, they've reported pain. Here's what am I thinking, maybe lateral head of gastrocs, and you focus your treatment as well as focusing on depth at that particular area. So your treatments become much more fine-tuned and deeper. And then finally, we achieve deeper pressure by using alternate tools of application. So our hands are tools of applications. But when we start to work deeper, we use what we call reinforced hands. So one hand on top of another. This is obviously to get the deeper pressure and to look after your joints as well. We also have forearms, which are great. You've got different structures of the forearms. You've got the underside, which is the softest. You've got the upper side, which is closer to bone, or you've got the edge, which is obviously the edge of the bone. So even with the forearm, you've got 3 different tools that you can use. Elbows, sports massage therapists love elbows. Very good for pinpointed or very deep work. And you've got fists, that you can form a fist and move through structures. So you can come up through the calf, or you've got knuckles. So there are tools of application. So practicals from now on is starting to use those different areas of our body as our massage tools. Now, before we do any practicals, we're always going to have a little bit of a theoretical recap, because it's really important to understand what it is you're doing. It's all well and good to go away and just learn a routine or learn how to give a deep tissue massage, but you should understand what you're trying to achieve by doing that, because that is what's going to make you a better therapist, obviously. So we've come across the term effleurage in our Swedish massage training. So it's the same principles and the same physiological effects, but because we are using deeper pressure, because we are using different tools, we call it compressive effleurage. And then there is also stripping. So to do this, we can use reinforced hands, forearm, and we can use our thumbs for stripping. So the gastrocs is a lovely muscle to strip, because you can run up really deeply from the Achilles all the way up through the muscle and then split the 2 different heads of the gastrocs. Forearm is easy to use on calf because it's a nice bulky muscular area as well. And what we're trying to achieve with our compressive effleurage is you're basically pressing the tissues, the muscles, the fascia, whatever you're working, against your tool, your hand, your arm, but also against the underlying bone. So you're getting a squeezing, compressive effect.
When you say about the thumbs going up,
yeah,
that's a deeper technique than the forearm, because you've got more surface
well,
on the forearm.
yeah, it can be, depending on how much obviously pressure you put through those
Right.
thumbs, it can be quite pinpointed, yeah.
So would you start off with like a forearm as more of a general before you went in with the thumb or not?
I would tend to use reinforced hands first. I tend to put quite a lot of pressure when I do forearm, just because I lean my whole body weight in. So
that's the whole thing with effleurage is to warm it up or not? So you can do deep effleurage after you warm up?
These are more sport specific, so you might want to start with the Swedish effleurage just as an introduction to your touch, and then you could do your deep effleurage, and then so this is the compressive effleurage is activating the muscle spindles and Golgi tendons. They should be terms that are familiar to you from your anatomy physiology, and we will revisit muscle spindles and Golgi tendons a lot in massage training. But basically, they are mechanoreceptors that sense that compressive force and initiate a reflexive relaxation of the muscles. So effleurage and stripping can help with muscle spasms, can help reduce tonicity, and so a muscle when it's really tonic and tight, it's called tonicity. And we're familiar with the term petrissage, again from the Swedish massage. The same physiological effects apply, but we just do it slightly deeper when we're doing sports massage. So it can help with fluid exchange and inflammation, removing edema. We should remember from our contraindications that massage in acute inflammatory injury is contraindicated. This is referring to chronic inflammation or residual edema. But use our hands and fists, but it's basically, it's the same petrosal, that lift and squeeze movement, but we are using our intention to focus on depth and to slow the whole technique down. We're going to